and today I'd like to share our recent approach about the beta cell replacement therapy for type 1 diabetes. So, as you know, the type 1 diabetes in worldwide, more than 8 million patients, and they require lifelong intensive insulin therapy. And among the type 1 diabetes patients, there's the subgroup, brittle diabetes. Despite of intensive insulin therapy, glycemic target cannot be achieved in some patients, and approximately 10% of the type 1 diabetes individual are affected, and they experience severe hypoglycemia, unawareness, and the risk of fatal outcomes. So to this type of the type 1 diabetes, the pancreas or islet transplantation remain the only definitive therapeutic option. But there is a couple of the limitation for this kind of approach. So let me go through the history of the beta cell replacement therapy for people with type 1 diabetes. Pancreas transplantation, which achieve high rates of insulin independence and restore physiological glucose-induced insulin secretion with a reduced risk of hypoglycemia, began in 1960s. This was actually followed by the development of the islet transplantations, a less invasive approach that also enable physiological glucose insulin secretions. Furthermore, since the 2010s, efforts have focused on the transplantation of the islet cells derived from the pluripotent stem cells like iPS cells. This is a demonstration of the changes in the blood glucose levels before and after islet transplantations. This is basically the case presentations of the 27-year-old female carrying the type 1 diabetes for more than 12 years. And as you can see here, islet transplantation is expected to markedly improve both blood glucose levels and the glycemic variability. This slide shows the global distribution of the allogenic islet transplantation during the 2000 to 2020. As you can appreciate here, a total of the 4365 allogenic islet transplantation have been carried in 2170 patients, primarily in North America, Europe, Australia, and Japan. These procedures are largely limited to specialized centers within developed healthcare systems. Their implementation is strongly influenced by the regulatory frameworks and the reimbursement policies. So this is the efficacy and the safety of the islet transplantations result from the multi-center study in Japan. As you can appreciate here, that the islet transplantation improve A1C levels, reduce insulin dose, and reduce the risk of severe hypoglycemia, and in some cases, eliminated the needs for the insulin injection. So it's kind of a dream therapy for people living with type 1 diabetes, I would say. We also evaluated the patient-reported outcome using SF36 scores. And as you can see here, islet transplantation led to improvement in QOL assessed by SF36. As you can see here, the low physics, low emotional, low functioning, mental health, viability, general health, everything is improved during the course of the 2-year follow-up period. However, these islet transplantations have several problems. First one is the long-term islet graft functions remain insufficient. And then second one is a donor shortage persists in Japan due to the societal factors. And then irregular procedures create staffing and cost challenges. So to solve this, we actually turn to pluripotent stem cell derived islet cell transplantations, which allow us stable supply of the transplantable cells, reduce ethical constraints, and expectation for longer graft function maintenance. So pluripotent stem cell derived islet cell transplantation actually getting strong global attention as a treatment for the type 1 diabetes. And this is kind of a cartoon showing the iPS cells. As you know, iPS cells are pluripotent cells established by the Professor Shinya Yamanaka Nobel Prize winner. And iPIC cells, which are highly purified iPS cell derived endocrine cells population that forms islet-like structure in vivo and developed through a 5-year T-SILA program based on Dr. Taro Toyoda's method. And this slide basically shows that the results of the transplantation of the iPICs in an immunodeficient T1D mouse model, looking at the insulin secretions. As you can see here, by transplanting iPIC cells in mice, ameliorate glycemia and allow detections of the human C-peptide insulin. And also upon the OGTT, there is a very nice induction of the C-peptide secretions. And this is actually dependent on the glucose levels as evidenced by the upon insulin injection, there is a reduce of the C-peptide levels. So basically, iPICs regulate physiological insulin secretions in immunodeficient diabetic mouse models. Of course, one may concern about the safety. So we also checked the safety during the 1-year safety trials in mice. As you can see here, that there is no tumor formations, and everything shown here is either the pancreatic beta cells or alpha cells. And again, no abnormal findings were found 1 year after transplantations of the iPIC in non-diabetic immunodeficient mice. And also here, if you see here, the human C-peptide are detectable, and compared to the sham-operated mice, there is a tendency of the lower glucose levels. Of course, we check this the iPICs in larger animals like mini pig models. As you can appreciate here, that this transplantations in type 1 diabetes mini pig model enables engraftment and the restoration of the normal glycemia. And as you can see here, that the human C-peptide are detected. Of course, we need to create these iPIC cells more suitable for transplantation into the people with type 1 diabetes. So we made this biodegradable gel sheet containing many iPICs, and we actually tested this in mice models. And again, we see a very nice reduction of the glucose levels. And this is the graft staining, as you can see here, that the islet structure maintained. So using this kind of the iPICs or the seed form iPIC, which is we designated OZTX4110, we can basically ready to make the therapeutics to the people with brittle type 1 diabetes. But of course, to have the clinical therapeutic grade, we need to have the many barriers solved. And this is one of the difficult part, establishment of the scalable and highly reproducible CMC process for this product. And as you can see here, that the iPS cell derived iPICs can be cryopreserved for long storage. And once the transplantation date is determined, frozen iPICs can be sold and prepared as a sheet form graft within approximately only 2 weeks. And the prepared seed form iPIC product, OZTX, is shipped from the cell manufacturing facility to transplantable hospital center. And at the center, the package is simply opened and the graft is ready for the transplantations. And actually, we announced the information about this first-in-human study for OZTX 410 starting from the January 2025, last year at Kyoto University, to reduce burden of multiple daily insulin injection in type 1 diabetes cases. Here, the clinical study design for the phase 1b OZTX4110. And basically, this is a single center dose escalation study. We only recruited 3 individuals with a type 1 diabetes brittle, and cohort 1 received low dose cell transplanted, then the cohort 2 middle dose planted, and then third cohort is a high dose planted, transplanted. And we basically check the 1 year adverse events, and then as an extension, we also check the 5-year adverse events together with the exploratory endpoints, including serum C-peptide, A1C, CGM parameter like a timing range. And this is kind of a scheme of the transplantation side of the OZTX110. And at the abdomen, we insert this sheet into under the skin. And actually, the procedure itself is relatively simple and minimally invasive. So usually take 30 minutes to 1 hour operations. And we already completed the transplantations of this the sheet form IPIC OZTX to 3 patients, as shown here, by last summer. And actually, they are doing very fine. And some of the patients obtain very nice glycemic control without insulin injections. So we actually planning the multi-center global clinical trial based on the favorable result obtained to date. So this is kind of a summary of the cell therapy using the pluripotent cells like iPS to establish an alternative to islet transplantation. There is a couple of the company or group has been succeeding in transplanting the either iPS cells derived islet cells or the ES cell derived islet cells. But our case, the world's first allogeneic iPS cell derived islet-like cell transplantation allow a shorter time to transplantation and contributing to cost reductions. And hope we can report successful result in upcoming Diabetes India 2027. And I would like to give a special thanks to our team before closing my talk. Thank you very much.